Good afternoon, everybody. Welcome to our guest speakers, and welcome to the students who are interested in the residency programs that are being presented today. This event is going to be recorded for those who are not able to attend today's session and for whatever conflicts. And it will be made available on the AMC website. And for courtesy, please mute your mics until you're asked to have an opportunity to ask questions, and also you'll be able to ask questions through the chat if you're inclined to do so. Okay, let's see. I don't think is Dr. Katie Dinello in today? Oh, there's.
I'm right here. Hi.
Oh, okay, there you are, Katie. Okay, sorry. Okay, so our first speaker is Dr. Katie Dinello. She is with Vida Health, and do you have any slides, Katie, to share with us?
No slides.
Okay, Katie, the floor is yours. Please inform our students about Vida Health.
Okay. Hi, everybody. I'm Katie Dinello. It's so nice to see you all. I'm clearly not in clinic today. Sorry for my background. My kiddo turned 1 this week, but I'll talk about why I'm not in clinic in a little bit. But yeah, so I'm with the clinic called Vida Integrated Health. I'm the 2nd-year resident there right now. Vida is a clinic with 5 locations in the Seattle area. We have a Madison, Seattle location, Ravenna in Seattle, Kirkland, Bellevue, Everett. I think that's it. Yeah. If you come on with this residency, you'll be practicing maybe at all 3, just 1 or 2 out of Bellevue, Kirkland, and Ravenna. We have a ton of providers with Vida. So in addition to naturopathic doctors, we have chiropractors, acupuncturists, massage therapists, PTs. And so it really is such a great community of so many different providers, which is one of the benefits there. So the main docs there, so like I said, I'm the 2nd-year resident. Our 1st-year resident is Dr. Adair Ellie, and then we have Dr. Gonzalez, who is the resident above me, so she's technically done with her residency, and then Dr. Leary is our director, and then Dr. Corsilis, who's an ND and a PA as well. Everyone else I mentioned are NDs. So who's our ideal residency candidate? Well, we are looking for people who have a very strong work ethic. We are a very busy clinic. I think I saw 13 patients yesterday. So we want people who are fast and ready to just jump in and try new things. You know, it is a fast-paced, really fun clinic, so just be aware of that. We also are growing at a really high speed, and so we're looking for people who are flexible and adaptable. You know, a clinic that's growing, there's a lot of changes, and so yeah, we just want somebody who will just jump in and when asked, just kind of step up to the challenge there. People who are interested in primary care, we do a ton of primary care, especially the residents. So, and that's a great part of a residency, right? You want to learn everything and just be exposed to all that you can. You're going to see everything from hormones and gut health, sex hormones for men and women, thyroid health. We do a ton of IVs as well. So you'll be working on that skill, which is great. So our expectations really of our resident are just that you are a team player and that you will just jump right in and learn and not be scared to fail or mess up. That's why you have a really supportive team. There's a lot of great mentorship. That's kind of the whole purpose of our residency, and it's a really supportive environment. The cool part of our residency is that we are combined with functional medicine. So the other aspect is that we want a resident who is very, very interested in functional medicine. You can't not do functional medicine when you're in our clinic. So we are a dual residency with the Institute for Functional Medicine. That's what I'm doing this weekend. So I'm not in clinic. I'm attending one of their conferences today. So if you are interested in functional medicine, Vida is the place for you. If you don't know what functional medicine is, it's a great learning opportunity. I had never done any of the IFM courses before starting my residency and have learned so much. So that's a huge part of our residency. In terms of continuing ed and preceptorships, the majority of your continuing ed is going to be through the Institute for Functional Medicine with all of their curriculum and conferences. But we are so supportive of your goals. And so any conference that I've wanted to go to, I've been able to. And so it's really just a matter of letting us know what you're interested in. We're really encouraging of your interests and passions and what you want to pursue. So in terms of compensation, I'm going to defer that to Dr. Leary. So if you guys have my contact information, or if Dr. Garcia can give that out, you can just send me an email and we can give you that information. Okay, I think I hit all my bullet points. Questions? Do people have questions? I don't know if we're saving those for the end.
Questions from the group?
Yes, I have a question. Hi, Katie.
Hi.
How does the rotation for the 3 clinics work? Are you assigned a different day or a different month, or like is there like quarterly period where you're at different clinics, and are you assigned a specific mentor that you're working under?
Yeah, really good question. So it kind of depends on the schedules of the other doctors. So I started my whole first year, I rotated between the Ravenna and the Bellevue clinics. And so on my Ravenna days, I was with Dr. Leary, and then on my Bellevue days, I was with Dr. Corsilis. And now I actually rotate. I just switched to rotating between the Kirkland and the Bellevue locations. Mostly it was because I live in Kirkland, and so it just made more sense for me. And so on my Kirkland days, I'm with Dr. Leary. On my Bellevue days, I'm with Dr. Corsilis. So there's a little bit of room for, if you live somewhere, kind of, we try to make it work best. But yeah, there's really no set pattern. It's kind of just what works best for the clinic at that time and what works best for the resident. So we work with you on that.
Thank you.
Yeah.
Okay, I believe we have one more question from Emily Morris.
Hi, Katie. I have a quick question. So for the first year residency, is it primarily rotating with the doctors there, or do you also see patients on your own?
Yeah, great question. A little bit of both. I didn't get as much shadowing time as I would have liked because Dr. Gonzalez had some family stuff, and so that they kind of just threw me right in. But ideally, you'll get a good amount of shadowing time with Dr. Leary and Dr. Corsilis, rotating between those two, and then we'll slowly ramp you up. And so it ideally will look like you shadowing most of the time with them, and then adding urgent care patients on to your schedule if we need to squeeze those in, and then slowly you do less shadowing and more of your own patients. And so I just started my second year technically, and I'm full schedule 10 to 15 patients a day, which is so exciting and really good room for growth. But like I said, the mentorship is a really supportive environment. So if I have any clinical questions, I can call Leary or Dr. Corsilis at any point and get a quick response.
Okay, for the sake of time, we'll have to move on to our next speaker. We have Dr. Emily Nesnak, who is a provider at the Neighborhood Naturopathic, West Seattle. Emily, the floor is yours.
Great, and apologies for showing up a little late, but I'm just going to kind of jump into what our residency looks like here at Neighborhood Naturopathic, and then just make sure there's some time for questions. So we're located here in West Seattle. We've got a clinic of 3 doctors, and we currently have a second-year resident and a first-year resident, and then also part of our clinic team, 2 phlebotomists/MAs that help doing blood draws, allergy shots, vaccinations, etc., and then 3 front desk staff. So we've got a lot going on in our little space here. Right now we're in our second year of residency. So our first year of having a resident was last year, and it was a lot of fun. And I feel like a really great experience for our resident. We tend to have our residents start off with shadowing while they're getting their license all set and getting set up with insurances. And then we like to open up their schedule right away because we believe that learning starts when they start to see patients on their own. So as part of their being a resident here, I would expect to have residents start to see patients right from the get-go. So our current first year resident, she's been with us for about a month and she started seeing her own patients just earlier this week and has a lot of support from us here. Like I said, there's 3 doctors who are part of our clinic, and depending on the day, there might be 1 or 2 or all 3 of us in, but we definitely make space for our residents as well. Our clinic is a primary care clinic. We see people of all ages, so newborns through adults, doing both pediatrics, women's health, and men's health primary care. There aren't any other clinics in West Seattle that are taking primary care patients at this time. So we're pretty busy doing a lot of that work for our community here. And then we've got the providers all kind of specialize in other different things related to naturopathic medicine. So Dr. Taylor focuses more on digestive concerns like SIBO, IBS, IBD, etc. And then myself doing a little bit more fertility and postpartum health. And then Dr. Erica Dortero, who is here, focuses mainly on pediatrics. So you get a wide variety of exposure to both primary care and specialty concerns here at Neighborhood Naturopathic. We, like I said, we're a small clinic in West Seattle, and it's a nice place to be. Most of the doctors are working here in West Seattle, and so we'll see our patients out and about. So it's got kind of that small town feel to it while we're, in the big city of Seattle. But you'll see a lot of our patients knowing each other in the waiting room. So it's a fun place to be. That is just my really brief summary about what our clinic offers here and kind of what a little tidbit of what our residency has. But I'd like to see if there's any questions that I can answer, any specifics for anyone who is participating today.
Do you accept preceptorships at your clinic, Emily?
Yeah, we do. We really encourage students who are interested in our residency to start off by precepting with either myself or Dr. Taylor. We're both in on Wednesdays and Fridays, so that could be a great way to kind of bounce back in between our rooms on those mornings, or yeah, probably morning would be best those days so they can get a feel of what the clinic looks like. We've noticed a big difference for people who our current resident who kind of spent like a good 3 to 6 months shadowing, actually had a lot of baseline knowledge of just the ins and outs of how the clinic works. So that is definitely a good way to see if it's a good fit for both parties involved.
Okay, any questions from the group? Okay, if there are none, we will have to move on to make sure that we have time for all the other speakers. And of course, you can always start typing your questions in the chat. So our next speaker is Dr. Kasra Pornadelli, who is the Medical Director of Northwest Center for Optimal Health. Kasra, the floor is yours.
Thanks, Gary, and thanks for bringing our group together so that the students can kind of get a little bit of a sense of what we do. So I've graduated Bastyr from class of '98. I'm a clinic director and have also served as faculty at Bastyr for both in the academic and the clinical environment. I've taught courses like cardiology and practice management, the radiology courses, and after a 10-year sabbatical, was asked to come back after doing quite a bit of leadership at the national level, and I'm teaching cardiology again. So if I missed you for cardiology, I apologize for that, but that's a big part of my interest. So our clinic has been in place. We're in Marysville, Washington. That's about 40 minutes north of Seattle. The clinic has been there since 1998. It was started by another provider, and then my wife and I, Dr. Dirks, who's one of the other clinicians, purchased that clinic in about 2003. We have 3 providers total, and provider experience includes clinical practice, teaching experience at Bastyr, and also quite a bit of leadership. So I've shared with you my experience in teaching. As far as leadership, I'm the twice elected state association president here in Washington State, the twice elected National Association president for the ANP. And I'm all about growing and building this profession and helping students and graduates succeed. So as far as Dr. Dirks, who is one of our other clinicians, she graduated Bastyr University in 2001. So she's just over 20 years of experience in clinical practice. She's also been faculty at Bastyr teaching counseling and the clinical lab. She has stayed out of leadership because she's a great clinician. So that's what she'll bring to the table. Dr. McBride, who is our third clinician and also did a residency at our practice, is in her 5th year of clinical practice. After her residency, she signed on and is a staff physician. Her interests are physical medicine, pediatrics, environmental medicine, and she does more of the primary care at the clinic. So as far as specialties, we see a range of patients. Even though we initiated our clinic as a primary care clinic, I would say that the majority of our patients are now seeing us for specialty care. We still do primary care. We still see kids. We still, address medications when people need medications to be addressed. But a lot of what we're seeing is people who really want to step up to that next level and improve their health, particularly after COVID, and are looking for better than average. And so we're delighted to kind of help meet that demand, and as there's been quite a bit of growing interest. So we see patients for GI and endocrine and allergy, and there's probably not a condition that we don't see in our clinic. As far as the residency specifically, so our residency is a 2-year residency. And we have graduated 5 residents over the past 15 or so years. Every one of them has ended up in either a successful clinical practice. Many have done leadership. We have excellent relationship with all of them. A couple of them stayed on. We recently, one of our doctors who had been with us for 13 years, who was our first resident, moved out of the area and has a very thriving clinical practice in Olympia now. As far as the flavor of the residency, folks, what it looks like is we're very serious about education at our clinic. And we start out with a similar model to what you'll have as a student clinician. We'll have review and preview. So we talk about the day's cases. It starts out with a period of observation where you're teaming with one of the 3 doctors in our clinic. And then that kind of shifts over time to where, you're learning, you learn the MR and you start doing the history taking where the doctor is with you. And then once the graduate and the attending physicians feel like it's the right time, then that graduate, that resident is kind of let loose where they're initiating the patient visit. Then the doctor comes in, and so it becomes more autonomous as the students, as the graduates' comfort level and skill level kind of meets that space. So, and we've had a variety of experiences with that. One of our residents, within a couple of months, she was practicing autonomously. Another one, it took maybe the better part of the year to feel like she was, comfortable in that space to have autonomous visits. And so we're like I said, we're really serious about the educational process, and we don't need to have residents. It's not something that we need as a clinic. It's something that we really want to do, and because of our commitment to trying to have doctors be very successful. As far as compensation, I would say the compensation is consistent with the industry. We won't be as high as some of the well-funded educational institutions, that tuition dollars fund, and we're not going to be at the bottom of the level. We pay a commensurate and fair value for what the residency affords. As far as opportunities for our clinic, I would say the graduate who is looking to plant themselves in clinical practice, it's a good space to learn that. The graduate who is looking to understand leadership opportunities and wants to kind of get involved more politically. Certainly, there's probably not a better space to do that. As far as outreach, we do radio programs. So the graduate who wants to have experience in public speaking, or getting on the air, that's a good learning opportunity there. As far as information more about our clinic, I invite you to check out our website, ncoh.net, and for Northwest C for Center, O for Optimal, H for Health.net, or our Facebook site where you can see our clinic values, where all of our employees and staff came up and physicians came up with those values, and we renew them every year. That Facebook site is facebook.com/natural medicine doctors. So facebook.com/natural medicine doctors. I congratulate you on having gotten this far, and wish you the best, whether that includes our paths crossing or not. So glad to see all of these other doctors here, and I thank you, and Gary, thank you for bringing us together.
Welcome, Kasra. Let's see, any questions from the group? Okay, just as an FYI to the students, if you already have an AANMC residency student account, you will be able to access all the information in terms of the contact information of our speakers today there. For those who are also interested in getting a list from me, just send me an email, and I'll certainly share that with you. Okay, so any questions for Dr. Pornelli?
I have a quick question. Dr. Pornadelli, thank you for that information, and it's good to see you again. I was curious if you all offer preceptorship or just the residency.
Yeah, thanks for asking that, Maya. We don't do formal preceptorships anymore, and the reason why is we really like to focus on our residents. And having said that, and I invite any student who's interested in what we do to perhaps come out and spend a day with us to get a good flavor of what it's like. Let us buy you lunch, and then that way it'll give you a better understanding of kind of what we do as a clinic. So thanks for bringing that up. Yeah, it's something I didn't speak about.
Okay, any more questions for Dr. Pornadelli? Okay, that's the case. Then we'll move on to our next guest speaker today. It's Dr. Owen Miller. He is the Medical Director of Holistic Health in Tacoma, Washington. Dr. Owen, the floor is yours.
Thanks, Gary. Yeah, I too appreciate the opportunity to share experiences that I've had with residents over the years, and tell you a little bit more about our clinic opportunities. The Holistic Health Clinic is a family-owned and operated primary care clinic in Tacoma, Washington. And we're a team of naturopathic physicians only, and support staff committed to providing our patients with safe, effective health assessment, treatment, and recovery strategies. Yeah, but all, trying to be in a nurturing, empowering environment, just focused on integrative medicine. I graduated in '85 from Bastyr, and participated in the political movement at the time to achieve a new licensure for naturopathic medicine. And when we did that, I decided that my professional contribution would be to support residencies. And I started that about 28 years ago as a primary care residency in Tacoma. We about approximately 50 residents have poured through our office over the years. We have 3 doctors, 3 naturopathic physicians that take a resident. And that's cool because it provides the opportunity for residents to, trade off and experience the other doctor's type of care or mannerisms, that sort of thing. Well, our residents have a similar start as Dr. Pornadelli's and others, where they start with shadowing. They'll shadow the resident of the provider team they're assigned with, they've chosen, in the first month, 3 to 4 weeks. And during that time, they're beginning with observing, and then with tutoring, by the outgoing resident until that outgoing resident is satisfied with the work performance. And then they're gone. Sometimes they stay on for 2 years, and that's a big plus for our patients and our staff alike, because continuity and security is really a desirable outcome. But not only. And though that second year would have a different role in the clinic, more expanded role. In fact, the role for the first year resident expands pretty quickly in the first few months to bring on patient care that is start to finish. Whereas the first portion, the resident is providing the clinical intake and examination of the patient, and then meeting with the primary doctor to discuss the case and where to go from there with evaluation and treatment. And then the primary will finish the encounter. That's how we start, and we actually go through the whole year that way with the majority of patients, so that the new resident, the first year resident, has daily interface with their primary doctor. It's not a mentoring, it's a side-by-side in that exchange experience, and each having their own purview and then meeting together. It begins in the morning with a meeting going over all patient care and getting set for the day. There's also some meeting time after lunch to get reoriented, because schedules do change. But it's a very fast-paced, busy office. We've been blessed with a tremendous outpouring from our community in Tacoma, throughout all of Pierce County. And we take care of people in kind of two different ways. One is to follow the conventional medicine in a way, which is to reduce morbidity and mortality, to help people feel better, function better, and to live longer. Yet with the addition of natural medicines, evidence-inspired natural medicines. Everything we prescribe has legitimacy in scientific fact. Whereas the organization of that, well, that's a creative phenomenon that is inherent to naturopathic medicine for the last 150 years. And you could call it nature cure, but that's an antiquated term, like living consistent with the with nature. These are ways that 100 years ago, 80 years ago, lifestyle medicine was described. And so now we use the term lifestyle medicine, same thing. But it isn't just helping people eat better and exercise better and sleep better and feel better. I mean, those are all good things, but it's to help them transform their life into a life of greater abundance, greater health, and greater possibility. Our observations are that if we help people get healthy, not just use medicines to feel better, but to get healthy, we can facilitate resolutions in chronic disease, chronic inflammatory, chronic degenerative disease, which is arguably a category of care that has no proof for causality or cures, period, end of story, with all chronic diseases. Well, we see resolutions in type 2 diabetes. We see resolutions in rheumatoid arthritis, osteoarthritis. We see resolutions in eczema and psoriasis. We see resolutions of anxiety and depression and menstrual disorders. We see resolutions of chronic kidney problems, chronic liver problems, even throwing back dementia a league or two. These are the outcomes of the promise of naturopathic medicine, the art and science of the cure, not just the art of the cure, as in time honored. Well, that's great, but not good enough. It needs to be validated. And so we've been collecting clinical outcomes data for the last 2 years to report to the profession. We have a paper now in peer review and are aiming to publish additional case studies to illustrate the type of application of the modalities that you've learned, so that everybody can try and experience and integrate these methodologies into their practice. It's just contexting. It's not new stuff. To that end, we do support ongoing continuing medical education. And though we don't want you to just expect that, oh, I want a place where I can practice what I already know. We've seen residents like that, and they don't walk away with what we want to share. We want to share our 60 years of clinical experience, particularly with lifestyle medicine, which is brand new. Just this last year, board certification occurred in mainstream on lifestyle medicine. Well, but where's naturopathy on that one? That is who we have always been, in addition to natural medicines. That's certainly a big part of it, but not only. We're looking for residents that are eager to learn new things, as well as to apply what they already have learned and create a deeper understanding within the context of sharing and nurturing with their primary. We have 8 doctors right now, 3 first-year residents, 1 second-year resident, and 4 associates, and myself. We're going to lose one of our associates, Dr. Judah, after about 20 years of service, is retiring this year. And we'll miss her, and we want to find somebody to replace her. But our clinic isn't aimed at training doctors to work for us. We aim to train doctors to be successful where they want to be with the patient base that they desire most. And to that end, our doctors do have a bit of a difference. I tend to do a lot more behavioral modification, aka lifestyle therapies. We have female doctors that do all the women's healthcare. I stopped doing that after 10 years of being a women's healthcare specialist and pediatric specialist. And I do all the men's exams now, and half my patients are men's health. And so I'm looking for someone in particular who is interested in a men's health focus of a primary care practice that has an asset to help patients provide resolutions to their problems. And I'm willing not to have a resident until I find that special person. In the last 2 years, I have been successful, and this year with my resident now becoming second year, Harpreet Uppal, she is available to talk to if anyone is interested in communicating with her about her experience. At any rate, it's just a whole lot of fun to work with new graduates. You people bring in new ideas and challenge us in ways to define and call it justify concepts that we take for granted, and it freshens everything up, and it's really a pleasure. So I encourage everyone to open up and share all of our collective information with other students. We've been taking preceptors and residents for 28 years, and it's in Tacoma, so it's a bit farther to go, but you'll have a great experience. And we have several of actually all the students that have done advanced preceptorships with us have received a residency. You all are well-educated, smart, and have great clinical skills. We want somebody who is willing and interested in working together as a team and supporting one another, and not like, oh, this is my job, I don't care about yours. No, we want residents to work together and doctors to work together. And that's been how we've rolled for these last umpteen years. I've been in practice for 37 years, and it's just like a big family. So I encourage you to check us out, theholistichealthclinic.org. Thank you.
Thank you, Dr. Miller. Okay, let's see. Any questions for Dr. Miller? Yes, there's a question, I believe, from Emily.
Hi, this is Emily. I'm on Sierra's thing. My phone froze, but my question is, do you have any licensed acupuncturists on staff, and would you be open to having a dual license student?
My first year resident last year was duly licensed, but he chose to focus on what we call nature cure or lifestyle modification. And I've had residents who had acupuncture licensure in the past, and it was awkward to transition. You know, a first year resident gets going with acupuncture and gets a name, and then they're gone. So we're open to folding acupuncture and traditional Chinese medicine into our practice, but as just a first year, there would only be very, very limited opportunities for one to add a skill set that we don't have in our clinic, unless it's something that we are also willing to continue with thereafter. Continuity is king, and people hate it when doctors come and go. They hate it when services come and go, and it's a business killer.
Mm-hmm. Fair. And then, sorry, a second question, just to clarify, you're only accepting one resident this coming cycle, and you would like them to have a primary focus of men's health?
Well, no, we will have, I don't know where that one came from.
You're posted for 3 residents.
Yeah, we're posted
okay.
for 3.
Okay,
Yeah.
perfect.
And one is with me, and I have about half. I mean, I see about 50% men, maybe 60%, and a lot of them is to provide testosterone treatment in addition to the whole person care. Whereas our other providers, it's probably about 80% female. My 3 women associate doctors do all the women's healthcare. I haven't done any women's exams, gyne exams in 28 years, a long time, and so they do that all, and see way more kids than I see as well. So they have a younger female following all the way through menopause and beyond. Very comprehensive. There's fittings for for the NuvaRing fitting and removing. They provide that. That's my daughter, Dr. Julia Miller, who is in her 6th year of practice and is actually taking over the clinic. And she's been the associate clinical director for 5 years, and her mom and I are going to turn the reins over to her 1st of January. We're excited about that. We'll stay on in an advisory role, but you got new blood running the show from then on, and it's going to be good.
Okay, I'm going to have to call time, Owen.
Yeah. Thanks, Gary.
We have another presenter coming up. This one is sent in as a video, so I'll just go ahead and run the video. Screen share here.
Hi, my name is Dr. Laura Roos. I'm a naturopathic doctor and founder at Kansas City Integrative Health here in Overland Park, Kansas. We are excited here to have the first residency in Kansas, which really is focused on providing an environment for our residents to thrive after residency, to go out into the world and be able to provide great patient care and feel confident after they graduate from our residency program. We have multiple different providers at KCIH across a variety of focuses. We have 4 in person with 3 remote providers. Personally, there's a large focus on women's health and fertility, so we do have a large patient population with that. But also because of where we're located in the Kansas City area and the lack of access to other naturopathic doctors, we do see a lot of complex patients with chronic conditions. And our providers here really for the most part, see patients, womb to tomb. We don't always provide direct primary care because of the statutes within Kansas, but we often, because of that, we see a lot more complex chronic diseases. And so our residents see a lot of conditions that often require unraveling and unwinding. And we do as much as we can with the residency director and myself and other providers here to support our residents in that process, including chart review and preview for every single patient in the beginning. And then as there's more confidence moving forward, giving the resident a little bit more independence, as well as providing resources for research, as well as shadowing opportunities, both within the clinic as well as outside in the greater community. We have a great resource and references for collaboration with integrative providers, as well as integrative dentists, fertility providers, those kinds of things in the Kansas City area for preceptoring. Expectations for the resident is really to be highly motivated to see and deliver the best patient care, as well as independence in terms of, in the beginning, starting and maintaining their own schedule. We do what we can to sort of ease residents into the position, but ultimately we do have high expectations for the learning process. Our residents also will maintain active membership in our state association because we, as Kansas is not currently under prescriptive authority, we're currently going for further and further legislative action. And so that's one of the motivations for KCH is to support the KNDA, which is our state association. We also easily provide the expectations that you'll meet and maintain the CME goals for residency. And we do everything to support that without any issues. There are a lot of opportunities for preceptoring within the clinic and outside the clinic within other clinics that we have good relocations with. And we do provide a stipend for continuing education, as well as health insurance on top of the salary, as well as regular or quarterly bonuses in terms of assessing for performance. Our ideal resident here at KCH is one that is really excited to be in the Kansas City area. Naturopathic medicine isn't widely available or accessible here, and so being back in the Midwest is an opportunity to really be a pioneer for naturopathic medicine, especially old school naturopathy, because there's a lot of people here that really need naturopathic medicine, and we are filling a demand that is highly needed, and patients are highly motivated here to really make the changes that are necessary in order to get better. And we really want to make sure that we have an opportunity for residents to see and learn and have that hands-on experience so that they're able to thrive whatever happens next. Happy to answer questions if anyone wants to reach out. I think Dr. Garcia has our contact information, info at KC Naturopathic. You can definitely look at our website as well. Thank you for your time. Look forward to meeting you if you're interested in this area.
Okay, thank you, Dr. Bruce. Unfortunately, she's not here live, and if you have any questions, email me your questions and I'll forward it to Dr. Bruce, or you can also email me directly so that I can send you her contact information and also the contact information of Dr. Audrey Shenort, who is the co-supervisor of the resident in their clinic. Okay, let's see. We'll move on then to our next speaker, Dr. Landon Opunui. He is the medical director of Nepua, Hawaiian healthcare system. Dr. Landon, are you here?
I am here.
All righty, let me make you a co-host first. Let's do this first. It's much easier to do this way. Host. Okay, Landon. Now have an opportunity to do your screen share.
Got it. Thank you, Dr. Garcia, for having me. It's a pleasure to be here with all of you. I am a 2013 Bastyr graduate and also a beneficiary of an ND residency program. So this is my opportunity to pay things forward. My current role is quite unique. I am the interim executive director, medical director, residency director, and one of 2 naturopathic physicians on staff at Na Pu'uwai Native Hawaiian Healthcare System. And I am repurposing this slide deck just to kind of give you a little taste of the depth and breadth of what we offer as a community health center. But beginning with perhaps a place of foundation, just so you have a little bit more context about who we are and what we do. We are unique in the sense that we receive federal funding through the Native Hawaiian Healthcare Improvement Act, and we are one of 5 health systems across the states. We are the only one that uniquely serves 2 of our major Hawaiian islands, the island of Molokai and the island of Lanai, that sit within Maui County. We are funded as a result of a landmark study published in 1985 called Eolamau, which identified significant health disparities and rates of chronic diseases in Native Hawaiians, poor access to health services amongst Native Hawaiians, a shortage of Native Hawaiian providers, and a preference among Native Hawaiians for culturally relevant programs and services. I'll share this for another day. And the core responsibilities of our federal funding is to provide comprehensive disease prevention, health promotion, and primary health services, specifically to Native Hawaiians to improve their health status. But because we receive federal funding, we serve the entire community. So what we do and how we develop our residency program is carve out their experience into providing community outreach, health education, and of course, naturopathic clinical services. It's very important to understand the values of the patients we serve, the values of the communities we serve, and especially our indigenous patient populations, to enter in with a space of humility and try to understand how they view health. So Hawaiians have a lens of health embodied by this concept called Mauliola. This is our optimal health and well-being that encompasses the physical domain of health, the emotional, the mental, and the spiritual. So what we do at Na Pu'uwai is we provide integrative clinical care to provide treatments to the patients that we serve. We provide education and outreach in an attempt to empower those that we serve and provide them with a greater sense of resiliency. Culturally, we achieve this vision by acknowledging the important relationship with our land and our environments, by acknowledging that our relationships, which we call pilina, are foundational to our well-being, and that cultural identity is critical to our sense of healing. We do this within an integrative care team that is interdisciplinary in nature. I'll chat a little bit more about that. In the very unique and special communities that we have the privilege of serving, founded on Native Hawaiian cultural values. One of the amazing privileges that I have in healthcare leadership is I get to use our philosophy and our training to really reshape the way in which we are delivering healthcare. So I and my team created a Native Hawaiian integrative health center built on 3 pillars. The first are integrative clinical services, and that is very much inclusive of naturopathic medical care, and also unique to us is inclusive of traditional healing practices. The second pillar are providing culturally adapted programs to educate and provide outreach to the community that we serve. And then the third pillar are community resources intended to promote health and empower those that we serve. We humbly believe that this 3-pronged approach to healthcare is going to lead to improved health outcomes, getting us closer and closer to our target of achieving and restoring Mauleola. Feel free to visit our mission statement on our website to learn more about what we stand for. Our integrative medical clinic does both on-site and telehealth care, and primary health is carved up into integrative primary care, which is team-based, where we have our family medicine physicians working closely with our naturopathic primary care providers. We also have a very robust behavioral health program working closely with clinical psychologists. Our allied health services, we have a full-time nutritionist. In our specialty clinic, this is one of my little projects that I'm so lucky to work on. In Hawaii, just so you understand the healthcare landscape, we only have a couple of private health plans that cover naturopathic care. And as you can probably imagine, we have a payer mix on the islands that we serve that are not private insurance based. So what we did is we leveraged the federal funding that we receive to launch our Kavili Clinic and Kavili Pharmacy. Kavili in Hawaiian means to integrate or to blend. So this is our subsidized integrative medicine clinic where we can provide access to the patients who need our medicine the most with the highest quality naturopathic medicine. And combined with that is a subsidized natural medicine pharmacy to make sure that the medicines that we recommend those who are most vulnerable and underserved amongst us have access. We also offer acupuncture, and we also offer traditional healing services. Again, this is a residency program like no other, and it is going to require a very special fit to find a trainee that is aligned with the values of our community and the vision of our organization. We also have several integrative programs. We have an adult weight management program, and we have an adult diabetes self-management program. This is a cool video of one of our programs. Let's see if it plays here. It might not be. Oh, there we go.
Gonna go into the pan.
So I'm a big fan of culinary medicine. We have a culinary chef coach who comes into our community-based education programs and equips the participants that we serve how to prepare healthy nutrition with the goal of maintaining and sustaining nutrition as a foundational component to their care. And even bigger than that, to go home and teach their families how to prepare healthy meals as well. Skip over that. We have an integrative kupuna care program where we have adult daycare and adult home care services. So we treat the entire age spectrum. And we also have the only fitness center on the island. And this gym integrates intimately with the health clinic. There's referrals to our gym with our athletic trainers there, again, because exercise and movement is foundational to health. We offer care management. We have many patients who have very complex comorbidities. And as you can imagine, living in an island state requires travel between islands. So it requires quite a bit of care coordination. We also have a workforce development program, and this naturopathic residency was born from this. We have a big workforce shortage in Hawaii. So what we ideally want is for a resident to find a new home and a commitment to a new community, and ideally stay on the staff. This is our website, napu'uvai.org. We have social media accounts, and I'm very happy to answer any questions that you have.
Okay, thank you, Dr. Landon. Any questions from the group? We're at time, unfortunately, but if you have any questions, I'm pretty sure Dr. Landon would be more than happy to answer those questions. I believe he provided us with his contact information. And again, if you already have an account in the ANMC residency portal, you will be able to access Dr. Landon's contact information there as well. Okay, well, it's 1 o'clock. I want to be respectful for our students' time because they have classes to go to and shifts to go to. Thank you so much, everybody. Thank you, Dr. Landon, Dr. Kasra, Dr. Owen, Dr. Emily, and Dr. Katie for being part of this Residency Roadshow presentation. You all have a good day and a good weekend.